बहुत आगे Muted.
Survivability
Unmuted.
aspect. Much like the human stress response is adaptive to our survival, if and only if we can turn it off. Then resentment must serve a purpose if you can turn it off at some point. With the stress response, for example, if a tiger comes into this room, we are supposed to feel stressed. And that stress gives us cortisol and adrenaline and lets us run away or punch the tiger in the face or throw Paul in front of it so I can get out of here. And it would be cool. And
I'm heavier to move, so.
That's right. And then, so that would help keep us alive. But if we don't turn off that fear response when we leave here, when we're safe from the tiger, we're going to get sick. Our immune system will turn off, our muscles will break down, we're going to get sick. The same thing here is that if we have too much resentment and we never let it go and never move beyond it, we're going to get both spiritually and physically and emotionally sick. Here's another one of these things. If we could read the secret history of our enemies, we should find in each man's life sorrow and suffering enough to disarm all hostility. This means if we empathize and understand people, we can say, wow, this person is a total jackass, but I can understand why they're being a jackass and maybe I can let it go. Doesn't mean that we don't get them arrested for hurting us. It doesn't mean that we don't follow through with protecting ourselves, but we can begin to let it go. When I worked in the domestic violence field over at Berlin, one of the surprising things I discovered was that a lot of the men are truly afraid of their wives' anger. Now, it does not at all even remotely begin to justify the actions that they took, but it helps me understand where it was coming from, and if I can help treat the fear, then the behavior changes. Does that make sense? Or at least hopefully it changes enough to get them out of the group and have a better life. So first off, we're going to have to look at the stress response. If this is reviewed, because you guys probably all know this stuff, just say, hey, let's skip some of this stuff. We'll go through it kind of recently. Everett Worthington is a huge researcher on forgiveness. I have like 7 books of his, including the Handbook of Forgiveness, which is about this thick. It's an enormous book showing how complicated forgiveness actually is. So his topic here is that for most theorists who are not physiologists, anybody here physiologist? Because I'm not. Or neuroscientists and do not consult the literature, unforgiveness and forgiveness are conceptualized as being on a continuum. You either forgive or you don't. And that is actually not true. The stress and coping theory is based on the supposition that unforgiveness is a complex, tertiary negative emotion which can be high or low. That I can forgive them a little bit, I can forgive them a lot. It is the opposite side of the emotion wheel from empathy, sympathy, compassion, and love. So that helps us give us a clue. If we can train these things into our patients, including ourselves, then hopefully we can feel less resentment. So we want to up-train these things, down-train resentment. Emotional forgiveness is a complex, tertiary, positive emotion on which one can be high or low and is the product of competition. When I initially wrote this presentation, I had to write it in a bar because I had to read a lot of stuff like that. Why is the stress response important in a discussion of forgiveness? Why do you think? No. I had originally thought that I had this genius idea that I was going to be the first one to point out that unforgiveness
Unmuted.
Earth-shaking originality and zeitgeist-changing nature of this thought, somebody else had gotten there way first, and that is this Worthington dude. In his book, 2006, he argued the entire way that unforgiveness is really a stress response. And this gives us a totally different way of looking at it in therapy. Not only can we talk about it from the emotions and the experience and the thoughts and memories, we can actually look at changing the body response to it right now in session and see how they are experiencing it. This comes in with things like EMDR, comes in with some of the couples therapy that Gottman does when they hook people up with galvanic skin response sensors, and you can say, "I forgive you, honey." No, you don't. And so you can actually get down to some of the truth of the matter. Additionally, the more that we learn about human anatomy, physiology, and neurology and genetics, we learn that there is no separation between the mind and body. If we are to be effective therapists of the mind, we have to be aware of the physical correlates of the mind and body. Does that make sense? I don't think that we can do it accurately if we don't. So let's take a look at things that scare us. Spiders. Pay attention to your stress response. Alligator, that's a crocodile. Sharks. Scary fast dogs. A lot of our patients are afraid of this one. They're actually afraid of just fear itself. It's a self-fulfilling, I'm getting nervous, I can't handle it, I'm going to be embarrassed, I'm going to fall apart in a presentation in front of a bunch of my peers, and then I'll be terrified and mortified because of that. That's just fear itself. And then my favorite is we're all scared of Sarah Palin. Okay. Response to threat. There are 5 ways that we respond to stress. Most of us talk about 2 of them. We talk about the fight or flight system, and that's actually very shallow. Fight, obviously you're going to attack it. Physical violence sort of works. If you are being attacked by a mugger, if you destroy that mugger with your car, you're not scared anymore. Hopefully, as a human race, we can move beyond that, but it does work, and that's why we have evolved it. Flee, you can get away from it. This is really important when it comes to phobias. If I'm scared of spiders, if I flee the spider every time I see it, I will never get over the fear because I never get to realize that spider does not want to eat me. It just wants to make webs and be all creepy. Does that make sense? I actually used to be very afraid of spiders, and my wife is a veterinarian. I'm not allowed to kill anything except ants. She hates ants. So I had to sit in a bathtub with a spider for 2 hours. And by the end of it, I was not so scared of him anymore. It was actually quite cool. And now I actually really like spiders. So we can tend and befriend. This is a little bit sexist, but this comes out of research on women, that they tend to be better at these 2 than men are. So good job. But tending is basically maximizing your internal response to the threat, such as internal monitoring, calming, or solving practical problems with dealing with this threat. This is journaling. This is eating chocolate ice cream after a breakup. This is going for a walk. We men just go drink, and that's not a very good idea. Befriending is getting together to increase the chances of survival for the individual, although one person might get gobbled up. The interesting thing here is how does that relate to the concept of the identified patient in systems theory?
Well, it increases your identified patient to be the group.
Could be. It also means that one person gets sacrificed for the health of the group, which is a horrible way of looking at it, but that often happens in very sick systems. Does that make sense? So if we can see that the system is doing that to that one person, it's not the identified patient that's the problem, it's the whole system. And then freeze. This is a great one. The brain locks up and we can't think clearly. This happens a lot of us in modern society. When we're taking tests, we freeze up. When we're trying to think of the right thing to say to the pretty girl down the street, we just freeze up. And this makes sense in an evolutionary standpoint, because then maybe the threat will think I'm dead and just go away. That's useful if the threat is a Tyrannosaurus Rex. It is not so useful if it's the pretty girl down the street. Does that make sense? So the normal response is we perceive a problem, we perceive it as threatening, we see the spider, we would engage the autonomic nervous system, so then we do something about it. We either tend and befriend, fight or flight, or freeze, and then hopefully we get to experience the results of engagement. If we survive, then that stress response should shut off. We should be able to let it go. This again applies to resentment. Somebody hurt me. I'm doing something about it, and I can resolve the problem. Kind of what Paul was speaking about. If the problem is still continuing, let's talk about how we improve our marriage. And then it's resolved, it works better. If it's not resolved, then what do we do about it? If I can't turn off that response, we become exhausted.
So where does stress before a football game come in? If you're the quarterback?
If you're the quarterback, that would be you're perceiving that the embarrassment of screwing up or letting your teammates down would be the perception that it is going to happen. This is the threatening event. And then at that point, they can choose to do something about it. And they can relax, they can meditate, they can get in the zone, so to speak. They can talk to the coach, they can get a pep talk, they can go run to get the adrenaline off. Or they can sit there and ruminate on, I'm going to fail, I'm going to let everybody down, it's going to be terrible, and they will get the jitters and freak themselves out.
So it's not always a bad thing.
No, actually, we'll get into a whole concept of eustress later. No, that's great. Everyone know what eustress is? Okay, you do. Yeah, what is it?
It drives you. It's positive.
It drives.
So you gotta test the study. So
Perfect.
that you can do well.
It's that little bit of fear of if I'm going to fail, I got to work hard to achieve it. So it helps push us forward. If we're scared of the big game, that adrenaline can help us throw the ball farther, faster, better. I don't understand football, so they do things with balls. I don't know. So it helps us perform better. If we get too afraid, then we get the jitters and we freak out. If we don't care, we don't get excited about it. We just don't do anything. Okay. There are abnormal types of stress response, and this will apply both to threat and anxiety and phobias, as well as resentment and forgiveness. There's the hair trigger response, the excessive response, the inability to cease the response, and the learning disabled response. The hair trigger is that I'm going to see a small problem and get very, very afraid or very resentful of it. We see this a lot in patients on Xanax. I hate Xanax from the bottom of my soul. Because what tends to happen is Xanax works super well. But the instant they get this much anxiety, they become anxiety intolerant. And they run straight to the Xanax because they don't want to feel it. They have a hair trigger response to anxiety. We're supposed to feel anxiety. Life is supposed to suck sometimes. And we have to learn how to deal with it. We can get through without medication. Otherwise, they keep going back and back to it, and they can't deal with life's problems, and they become addicted. They die, and it becomes both
muted.
Dealing with it appropriately, having an appropriate level of response to it. Inability to cease, we've talked about that when we have to turn it off in order to be able to rest and recover from it. And the learning disabled response is I never learn when to engage it correctly. A little bit more about each one. The hair trigger is insignificant or unimportant events trigger it. Performing in public is not a threat to your physical body. I am not going to die. You are not going to kill me from speaking in front of you. But it makes me nervous. It's a threat to my self-esteem. However, my body is really stupid. It cannot make that distinction between a bunch of T-Rexes and you guys. And so I feel all of the fear as if you were a bunch of T-Rexes trying to eat my face. The excessive response that's the deer in the headlights response. You become paralyzed by the stressor. People and animals, particularly birds, have been known to die of fright. Wife is a vet. She absolutely sees this. Rabbits, birds, cats, they just scare them, they die. It's excessive cortisol, they go into a heart attack and just die. Does that work well for the deer when they freeze in front of the headlights? They get smushed.
Works okay for possums.
Usually, sometimes. Actually, I hit a deer with my truck, and I was going really, really slowly, and she jumped up, and she was on the hood of the
Muted.
cease.
Unmuted.
Being able to be stressed is an important survival tactic, again, being chased by the tiger in the room. But if we can't respond to that, we will die. However, if we can't turn it off after it passes, we risk the development of stress-related illnesses, and forgiveness can actually lead to the cessation of the stressor. If we let it go, it's no longer stressing us internally. The learning disabled response is that habituation is when your body finally gets used to small stressors. This is me sitting in the bathtub with a spider. Eventually, I habituated to the spider and was no longer scared it was going to eat me. Over time, you no longer react with stress. In some people, habituation does not occur, leading to chronic anxiety and depression. Negative thoughts about the self, other people, the present and future. Anyone remember what that's called from Beck? It's the negative triad for hopelessness. And how well does that affect forgiveness? And thoughts about the self. If I can't handle life, I can't forgive the person because I'm not safe. If other people are unsafe and terrible all the time, I can't forgive them. And if life is never going to get better, I can't forgive because it will never be safe to. Resentment is stressful. I'm just going to talk here about how resentment causes stress. There are 4 lines of evidence that unforgiveness is physically stressful. First one is activity in the brain in the ventromedial prefrontal cortex, which your son was here for this part, decreases and the limbic system increases. This is the part that gets pickled when we're drunk. It's the emotional part of our brain. So we basically get emotional and we become less logical. During resentment, it's consistent with activity in the brain known to involve responses to stress and negative emotions. So we actually have physical evidence in the brain that resentment causes stress. This causes our brain to think about things in the same way that stress does. Hormonal patterns, particularly cortisol or steroids, hydrocortisone. In resentment, it's consistent with hormonal patterns for negative emotions associated with stress. Cardiovascular, sympathetic nervous system activity, and facial ultromyography are similar between stressed people and people who have not forgiven. Actually, we have the same facial expressions between lack of forgiveness when you're thinking about, imagine them hurting you again, and stress. And the blood chemistry is weakly similar between unforgiveness and stress and negative emotions. And these are the things that they look at in order to look at the similarities. And there actually is some evidence that our body does respond to stress in the same way it does to unforgiveness. Does that make sense? More stress response. Human beings and other animals, because we are animals, will respond to stress with the same set of physiological responses, but in the absence of physical demands. Because we humans are smart, we will imagine things that can kill us, whereas deer don't. They see what's in front of them and get scared. We think, what's around the corner? What's going to hurt me? And we get scared. Such demands could include a transgression that would require forgiveness. How many of you heard a patient say, I had a dream last night that my wife cheated on me, and I was really angry with her the rest of the day, and I punished her for it? I'm like, you idiot. At what point does punishing her for your fear make any sense at all? Does that make sense? In 1936, Hans Selye described the stress response in 3 stages. It's coming back to school. There's the alarm reaction. Oh my God, somebody has hurt me. Resistance. Okay, I'm going to go talk to my counselor about it. I'm going to do something about it. I'm going to call my mom. Exhaustion is our defenses fail and we succumb to stress. Without defenses, our tissues can become damaged and even die. This is partially how chronic stress contributes to disease. However, this theory is incomplete as we are rarely truly exhausted, but the ongoing maintenance of the body is reduced during times of stress. This makes sense because if you are being chased by a bear, and again, our body responds to threats as if we're being chased by something physically, do you need to waste energy fighting off a cold that will kill you?
Muted.
That you just
Unmuted.
nope, because you have to become a cheeseburger. So basically, our digestive system and our immune system shuts down when we're under stress. This is why we get sick at finals week, finals flu, because we're so stressed. If we don't forgive at some level, we stay stressed, we can get sicker and sicker and sicker over time.
And that sick can vary depending on the person.
Absolutely.
So some people, when they get stressed, they get diverticulitis.
Mm-hmm.
Versus another person who might get just the flu.
Absolutely. And that's true when it comes to things like depression. You know, if I get depressed, I might sleep too much. You might never sleep. If I'm depressed, I might eat everything in sight. You may not eat a thing at all. So we're all going to respond to different things, and we still call that depression, even though they don't look anything like each other. I'm probably going to skip this slide because it's rather long. So It's on the slides if you want to see it. But basically, we get stressed, we have an alarm reaction, our body responds. Yeah, there's a lot of clicks. Hold on.
It's a cool slide.
I'm not kidding. It took me 45 minutes to make that slide. Okay, so we're going to look at the two branches of the autonomic nervous system. There's the sympathetic, which is the fight or flight response. This is the gas pedal. This enables the fight or flight or tend and befriend response. Heart rate increases, sweat gland activity increases, digestion decreases. This is important to know, especially with biofeedback, so we can see what's happening when, but also to understand why our patient's body might be responding in a certain way. It helps us understand why they're feeling what they're feeling. The parasympathetic is the baseline system. It's the idling speed that governs the normal function of the body. Heart rate decreases, digestion increases, and respiration slows. I used to call this the brake pedal. I got into a big fight with psychiatrists about that. We're both right. It's a metaphor. So he wanted it to be the idle. I wanted it to be the brake. It doesn't matter. Anybody familiar with the HPA axis, hypothalamic pituitary adrenal axis? This is how we get stressed. So it's a little hard to read here in a second. But basically the hypothalamus, which is way up here in the brain, is the pathway through which our neuroendocrinology responds to stress, which basically is how we physically respond to it. The hypothalamus releases hypocorticotropic releasing factor, CRF, which stimulates the nervous system. Basically, we have a chemical response. One of the things we learn from chemicals is they are not thoughts, they're not demons, they are not personality quirks, they are chemistry. If we can think of things as chemistry, it changes how we treat them. For example, we used to think of schizophrenia as double binds that people were put into in their growing up stages. That's not what it is at all. It is a brain reaction typically to an infection. And so we would treat them very differently. If someone's in a double blind, you think, why can't you think your way out of this? If they're having a chemical problem, you think, let's find the right medicine for you. Different treatments. This is the alarm phase of the general adaptation syndrome. It releases pituitary stimulating hormone to stimulate the pituitary gland. So that's the P, HP. The anterior pituitary gland releases adrenocorticotropic hormone, which causes the medulla of the kidneys, not of your brain, to secrete cortisol. Cortisol is a really big deal when it comes to stress. You'll often hear talks about cortisol in any kind of stress study. If you have high cortisol, you're typically under stress. It also, steroids make us fat, make us angry, and make us depressed. So if people are under stress, we will get fat, angry, and depressed. I don't know about you, but when I'm fat, I get angry and depressed. So it feeds itself. Basically, that keeps glucose in the blood rather than in the liver, increases vasoconstriction, which then increases our blood pressure. We get the pounding in our head, and we feel bad about that. Decreases urinary output in order to keep salt and water inside the body. So again, just by thinking about stress, we physically change a whole ton of stuff inside of us, including how much you pee. So the hormones here. These ones are kind of useful because of how they make us feel. The adrenal medulla, which is on the kidneys, not the brain, releases epinephrine, which is also the same thing as adrenaline, and norepinephrine. Adrenaline makes you feel afraid. So, as well as constricting the surface of the visceral blood vessels, dilating the skeletal muscles, elevating blood pressure, increasing heart rate, respiration, increasing hydrosis, which is sweating, increasing metabolism, and decreasing gastric motility. So again, physical responses that we can use and measure with somebody who is stressed. Noradrenaline makes you feel angry. So basically, again, feeling afraid and angry. This is important because some medications, psychotropic medications, will affect adrenaline and epinephrine. And obviously, do feelings of anger and fear come up with resentment and unforgiveness? Yeah. I know it's a lot. It gets a little bit simpler in a second. Cortisol, I talked about that, hydrocortisone. Cortisol in the saliva in this particular study was used as a direct measure for lack of forgiveness. The chronic stress of resentment leads to increased activation of the HPA axis and increased circulating levels of cortisol. So we could actually use that if we had able to do a blood test to see if somebody is moving towards forgiveness by decreasing cortisol levels.
So,
Yes.
can I ask a question?
Uh-huh.
So if somebody is taking hydrocortisone,
Uh-huh.
or taking a steroid,
Yep.
do you think there would be a correlation between whether they might find it harder to forgive?
Let me put it this way. I came home one day, and this is a true story. Came home, and my wife was on the bed crying. And she's like, "You're going to leave me. You think I'm fat." My wife is 102 pounds. She's super tiny. And I'm like, "Are you on steroids?" And she said, "Yes." And I was like, "You need to come off of them right now. Let's go talk to your doctor." Because it absolutely has an effect on people. This is why people they can start going to manic phases of bipolar disorder on steroids. People just look crazy on steroids. So if somebody's on steroids and they're having trouble forgiving, you might look at the doctor saying, maybe we're on too high of a dose. Does that make sense? So that's a great question.
That really explains somebody.
Well,
Good.
I just think it's someone too.
Perfect.
It came from, I have a patient with chronic illness and her body doesn't naturally produce enough cortisol, so she's on,
And she gets angry.
she's having a really hard time forgiving and she's really holding on to resentment. And so I'm sitting here thinking about, she needs it physically, but at the same time, it's presenting an emotional struggle for her.
That's important to know because sometimes if we know where something comes from, we can say, I still feel this way. And hormonal feelings are still very much real feelings, but they're not necessarily caused by the situation, they're caused by the hormone. If we know that, okay, I'm angry because I'm taking the hormone, it's different than I'm angry at you because you're a jackass.
Sometimes you can talk yourself out of the response.
Sometimes. I do have permission to tell that story, by the way, for my wife. Cortisol increases the amount of blood sugar, inhibits the immune system, so again, we get sick again, inhibits the proliferation of fibroblasts. Fibroblasts are in your fibrous connective tissue that make collagen. Cortisol in the saliva has been used, I know we already did that one. The prefrontal brain activity decreases under steroids, so we become stupider, we don't think clearly. Interesting thing, prefrontal brain activity is associated with ADHD. If that slows down, we look more ADHD. If we're around people who have ADHD, they are super annoying. And so people who are on high levels of stress are super annoying to be around. So they end up pushing people away, which is the exact opposite of what they need. Does that make sense? The limbic system takes over to keep us alive in the face of threat, so we react more strongly and emotionally, making us more super annoying to people. Stress and disease. When a stressor triggers the stress response, we get the cortisol secretion, fight or flight, inhibition of functions of growth, reproduction, and digestion over time. Over time, there's an increased risk of contracting or worsening disease because the stress response is too costly and eventually becomes damaging itself. It takes a lot of energy to respond to stress, and we get sick, we get weak, we get shaky. Diverticulitis. When the bowel breaks. Chronic stress occurs when the balance is out of whack. In Japan, they actually have a disease, which is that they're out of whack. We don't conceptualize it that way, and we should. It's an overactive central nervous system, overactive sympathetic nervous system. They call it sympathetic hyperarousal. I see a lot of patients who have this. I had a lady come in, a young girl who came in for sports, and she's having trouble with high jump. And when I hooked her up to the galvanic skin response, her galvanic skin response, just sitting there, was 30. Anybody know what average is for most people? 2 to 5. So that's just really, really high. So just sitting there, she's stressed all the time. And so she's wondering why she's super thin and why she's shaky. And she's just stressed by everything. So maybe competitive sports is not the right thing for her right now. Maybe cooperative sports or something like snowboarding where you just compete against yourself might be more helpful for her. The hyperdominance of the sympathetic branch is called sympathetic atonia. This is a fun word to say. I will never use that again.
Muted.
So stress. Stress is the body's response to a perceived threat. It prepares you to fight it or run away from it. Good stress, called eustress. Think of euphonium or euphony, which is a good sound, versus discord, what's bad sound. Got it. We'll come back. So some kind of stress is good. Orgasm actually requires sympathetic activity. And orgasms are good, right? Generally. So there can be good things of stress. We call this the point and shoot system. The point is P for parasympathetic. Shoot, orgasm, sympathetic activity. You have to have a balance of both of them. If you are too stressed, which is parasympathetic or sympathetic? Too stressed is which one? Sympathetic. So if you're too stressed, you're going to have premature ejaculation. You have inability to have an orgasm. So just by thinking about things too much and turning that on, we affect our relationship, which can then lead to resentment. Excessive stress, called distress, causes us to overreact to our environment and puts us at risk for stress-related illnesses. So we want to restore the balance. There are two ways to restore the balance. We can make the balance less reactive. That is burnout. This is we don't respond to anything at all. That's actually a terrible idea. Medications can also dull the reactivity of it, so we just don't respond as well. Again, not really a very helpful idea because you're living half-life. You're sort of, I don't respond to anything. I had a lady who was on a very, very high dose of Zoloft and her house caught on fire. And she talked about sitting there thinking, I should probably get up. I should probably move. It's on fire. She eventually got up and got out, but she did not have the motivation to get up and get out because she just didn't care. Does that make sense? So we want to restore the balance through awareness of small imbalances and restore them through interventions such as relaxation, meditation, biofeedback, EMDR, all those kind of things that tend to help people relax. Everyone know the difference between homeostasis and allostasis?
Explain. You explain.
Okay. So homeostasis is that we think we have a stable point to go back to. And we used to think that our body was that way. It's really not that way. Allostasis is basically we're going to make lots of changes to achieve a certain point at a specific time. So for example, if I am resting, sitting in a chair, my heart rate should be low and my breathing should be low. And so we often train our patients to have low heart rate and low respiration rates. But they'll come back and say, man, I passed out. What happened? I was running a marathon. I was trying to breathe real slow. What the hell are you doing? When you're running a marathon, you're supposed to breathe fast and deep because you're running hard. So we should have a specific way of being at specific times that help us adapt to the situation. And that is allostasis. The greater the changes and the longer they are held, the greater the allostatic load. So if we're angry with somebody in a relationship, if we're resentful with them, we have to be married to them, we are going to be sick because we have this huge allostatic load because our ideal relationship is not what we have. Does that make sense? I would totally yawn too. It's boring stuff. No, it's a lot. So basically here we look at allostasis and emotional replacement. States of forgiveness can occur when we replace negative feelings with positive ones. This is even including towards the perpetrator, feeling empathy with the person who's hurt us. If we understand why somebody did something, we tend to feel less angry to them, even if it's entirely a made-up reason inside of our own head. I used to be really angry when driving when people would cut me off. And I think that person's a total asshole. And I get angry and I raise my fist and be a total child. And it didn't make me feel very good. Now, what I decided to change that with is when somebody cuts me off, I think they're probably on their way to the hospital. They're probably sick or pregnant, and I hope they get there. Do I have any evidence that they're sick or pregnant? No. But do I have any evidence that they're a stupid asshole? None. So if I pick and choose the one that makes me feel better, I'm going to feel better. And I slow down and let them go with it. Go get well. It makes me a better person. Does that make sense? So the replacement of feelings requires many changes within the body and the mind and the soul of a person in order to achieve that change. That is allostasis in play. So basically we're trying to help patients move from the state of unforgiveness to a state where they're safe enough to forgive. This also implies that forgiveness is not weak. We're not saying, oh, fine, do whatever you want to me. that is being passive, that's being a doormat, that's not okay, that's not forgiving, that's being a pushover. But rather an expenditure of effort and energy in order to forgive. This is the burden that resentment places on the body as a form of allostatic load. It takes effort to move that out of the way and get better, which is why they pay us the median bucks in therapy. I know what people like that. This is from Pope John Paul II. Properly understood, justice constitutes the goal of forgiveness. In no passage of the gospel message does forgiveness or mercy as its source mean indulgence toward evil, towards scandals, towards injury or insult. We can forgive and still have very strong rules of what's okay and what's not. Genetics, don't want to do this one. Okay. They talked about basically here about that it's going to be highly unlikely that we'll see any direct therapeutic applications of epigenetics on forgiveness in the near future. I don't think that's true. I think that we are getting faster and faster with looking at things biologically and being able to intervene much more quickly with things like that. So I think that we are going to look at genetic effects of forgiveness on people. However, such research has the ability to address partially why humans are the way that they are, which is kind of important. That behaviors are only partially controlled by genetics, leaving experience and free will to account for the rest of it. Our behavior is about 80%, we think, genetic, but 20% is still a free will. Is a lot of free will. We can do a lot with that. So, for example, if we're driving on the road and I'm genetically predisposed to be over here, I can be fine as long as I'm not over here. If I choose to be over here, that's just 20%. But it's the difference between death and driving safely. Increasing self-understanding and self-forgiveness, which is a big deal in people who have socially undesirable traits, such as homosexuality or major depressive disorder. One of the things that actually changed was the zeitgeist changed in people's feelings about homosexuality was people said it's genetic. There's a strong genetic component to it. And people said, well, it's not their choice. Whether that's right or wrong, it changed how people thought about it. Same thing when it comes to major depressive disorder. We used to think that depression was a weakness of people. And now we see that there's a genetic component to it. It's not that somebody's being immoral. It changes how we look at them. We see them as much more compassionate because it's part of who they are, not some immoral decision. Does that make sense? So the more we understand those socially undesirable traits. On a practical level, studying the aspects of biology, interestingly enough, this was 10 years ago I wrote this. This has changed significantly in 10 years. We are looking at people as much more in a healthy way, I think, so just in 10 years. So makes a difference. On a practical level, studying these aspects of biology, anatomy, and genetics will give us the skills and the language to discuss forgiveness with the medical profession, which is important. It increases interdisciplinary communication and creativity. I get a lot of patients from my medical doctors, and they're like, so what do you want from them? I don't know. I don't know what to do with them. Just turf them. And so I get sent for all the stuff that they don't know what to do with. The more that we can communicate all that stuff that they don't know what to do with in their language, the more referrals we will get until we're at maximum capacity. Here's the fantastic word. Pleiotropy and heterotypic continuity are when the same genes that influence one trait later influence another trait. For example, genes that lead to a condition of chronic pain also creates life conditions, pain and suffering, that contribute to later depression. For example, if I have if I have spina bifida, that is going to change my social experience. I am not going to date in the same way I would if I didn't. So I might be lonely, I might be sad. And those are how those things relate together. This is, again, why I wrote this in a bar, because I'd be like, oh my God, how do I pronounce pleiotropy? And I don't drink.
There, right?
No, I don't even drink. I was thinking, how might genes that contribute to a propensity towards forgiveness fall into these? So if somebody is more likely to forgive, how is that going to affect the rest of their life, positively or negatively? They might get along with people better. They might not be taken advantage of if they have a high degree of not being being forgiving. So people who are real bitter may never be taken advantage of, but they may be real lonely. Make sense? So here's the empathy forgiveness link. According to these people, empathy, which is basically affective, I'm feeling your feelings versus just taking your perspective, is a critical condition for the capacity to forgive after experiencing a transgression. Empathy is actually not a good thing. It's not a bad thing. It is a thing. When the Nazis put sirens on the front of the dive bombers, that's empathy, because they knew that the screaming wail of a siren coming at you would scare the hell out of you. That is a really horrible use of empathy. Does that make sense? Sociopaths use that all the time. I'm going to be charming to you to get what I want to take advantage of you. Empathy is not good or bad. It is a tool. And so we have to be careful who we teach empathy to. We don't teach sex offenders empathy because they will hurt people. So empathy has a heritability of 72%, 51% due to genetic factors, and 49% due to non-shared environmental twin studies. Although critics say that probably overestimates the heritability. Empathy tends to be heritable around 30.3 for identical twins and up to 0.9 for fraternal twins. That was much younger. So there's a genetic component to being empathetic or not. This also laid some evidence to psychopaths being born that way. Although I've read a study somewhere that if you were in is it 6 or 7 foster homes, you're pretty much guaranteed to be a psychopath. Although if you're a psychopath, maybe you get passed around a lot. So it could go either way.
Well, isn't that also related to the attachment?
Yeah.
Early life attachment and trauma?
Mm-hmm. Because at that point, you're not going to be attaching to anybody. And nobody's safe because you're being passed from person to person. Or you're just a monster that nobody wants to have around. So it could go either way. Stress dwarfism is basically that when we are stressed, if we're growing, you can have adequate nutrition and still not grow. Failure to thrive, or people in war are actually much shorter statistically than they're growing up later because they just never grow. So you can see this is a very specific effect of how stress can affect our body because they don't grow the muscle and tissue and bone, so they just never grow up.
The foster kids are so emotional.
Mm-hmm. Exactly.
Just fine.
So here we have the function of negative emotions. Negative emotions have 3 functions that help people deal with threats to their well-being. Negative emotions alert people when undesirable changes have happened. If I'm angry with you, it's because you were doing something bad to me. In short, emotional homeostasis has been disturbed, allowing for a feedback loop to engage so that we can recreate that. If I'm angry with you because you stole my pudding, I will confront you about it, you will buy me a new pudding, and I will feel better. Or, if you don't buy any pudding, I cut you out of my life, and I feel better. Secondly, negative emotions can interrupt current behavior so a person can assess the situation. If I'm doing something bad, like sticking a fork into a light socket, and it shocks me, I should stop doing that. It's saying, hey, you should stop that. It also happens emotionally as well. Thirdly, a decrease in negative emotions indicates that a motive is being dealt with. If I am feeling better, I am making progress. And this is useful again with biofeedback, because you can see that they're generally getting towards a goal. Makes sense. It's about emotional scarring. Scars are marks left on the skin where a wound has not healed completely and fibrous connective tissue has developed. I really like this term, proud flesh, which is keloids. Those are the big ugly scars. Basically, they become ugly and irregular. Pride can lead to a lack of forgiveness and continuance of emotional wounds. Sometimes people in therapy don't forgive because they're too proud to, and we have to watch that as well. I had a couple where they were fighting over something, and he wanted her to take the trash out or something. They were fighting over that. She goes, oh, I should do that. And she agreed with him. She changed her mind. He would not let her change her mind. He's like, but you never wanted to take out the trash. I just said I would do it, but you never will. He would not let her say, I'm sorry. He was too proud to move on, which was scarring their relationship. Scars can also be a lasting effect of grief, fear, or other emotion left on a person's character by traumatic experiences. We have to look at where the scars are coming from. Lasting effects, these are kind of just some basic stuff. Kind of makes sense. 60% of people trust people who hurt us less, dislike them more. 22% have lower self-esteem as a result of being victimized by somebody. They worry about what people think about them, worry about being hurt again, lower self-confidence in some of those situations. And 93% still had negative feelings even long after the offense. It stays with us. Rumination is kind of a big one. We'll just kind of go here. Rumination is holding on to the memory of it. It triggers the sympathetic nervous system and proprioceptives, that's the physical sensations of the body, which can basically lead to action. This is reliving the situation, flashback, so to speak. If you change rumination, if you have people think about something different and not think about the same thing, they actually do begin to feel better. Oftentimes with people, including myself, if somebody hurts me, I will think about how could they do that? How could they hurt me over and over and over? And make up situations, and I argue with them in the shower, and it ends up making me angrier and angrier and angrier. So if you change the rumination and think about something else, like the beach or a flower, or forgiving them or moving on, we begin to feel better as we're letting go of that. We're not refilling that desire for revenge. Okay. That's very useful in biofeedback because you can get the overall level of stress down and see that happen and then allow them to forgive. Sometimes hate only nibbles at the edge of the heart. It does not always burn out the lining of the soul. But whether your hate is a carcinoma growing hell-bent for death inside your soul, or only a pesky heartburn, it will hurt you if you do not use the right remedy. Your healing may take heroic surgery of the soul, but then again, you may get by with a quick cauterization, but eventually unchecked hate will do you in. Some quick mind-body connections. You guys probably know most of this stuff, so we'll go through it very quickly. But basically, wounds and stressed people can take more than 24% longer to heal. That's a hospital day. So if we teach them to relax after surgery, they do heal better. If we teach them to relax after being emotionally hurt, they may heal better as long as we're not getting into the relaxation-induced anxiety. Unmarried patients without a confidant had a 3.34 times higher risk of death. Feeling loved is protective against atherosclerosis. Social support is a powerful protective against future heart attacks. This is, where's the guy out of Boston? Looks like Tony Shelby. Come back to me. But there's a whole plan with diet, exercise, feeling loved, and meditation. For people without heart attacks, it works really very well. Isolated parents who have lost an adult child are significantly increased risk of death in the following year. That is not due to confounds such as decreased hygiene and medication compliance. Being hurt increases our risk of death. More of them, healthy people who get depressed are 100% more likely to get heart disease in the next 10 years. Depression significantly increases risk of mortality following myocardial infarction or heart attack. This is not Mike, it's a person. Discovered heart rate variability increased the risk of sudden coronary death. And older patients with depression are much more likely to die than older patients who are not depressed. So actually, by taking depression away from people, we are saving their life, literally. Resentment and stress. We looked at college students when imagining forgiveness or holding a grudge. The people who had resentment states were much more physiologically aroused than forgiveness. So actually forgiveness is helpful, feeling resentful is way worse. So it's better to treat the negative aspects of it than it is to focus on just the forgiveness part of it. So we have to work through the anger before letting it go. Can forgiveness reduce healthcare risk? You don't really know. Maybe. It's controversial in the literature. But if forgiveness can result in positive emotions toward the wrongdoer, the immune system can be bolstered or at least not decreased, and we can reduce our stress and thus reduce our risk or severity of stress-related illnesses. So we can't say you will cure cancer by feeling better, which is in the realm of quackery. We can say maybe we can help reduce the intensity of your diverticulitis episodes if you're not pumping yourself full of adrenaline and steroids. Body language cues. This is a useful one for therapists. There are two different kinds of forgiveness. Anger-related forgiveness, called ARF, which is my favorite, which is due to obligation. I'm forgiving you because I have to, because my mom told me you're still an ass. Versus the self-explanatory unconditional love forgiveness, OLF. People who use ARF are more significantly masking smiles. You smile here but not here. More downcast eyes. Yeah, I forgive you, jerk. And more hypertension at 1 minute than people who actually do forgive. So we can actually measure how they are forgiving. So we need to ARF at people. If you don't deal with a problem, you can turn a healable relationship into a hostile one. Chronic unforgiveness can stress the immune system through activation of sympathetic fight or flight, leading to increased stress-related illnesses. We talked about that one. So you actually have to deal with it. Unforgiveness goes along with stress or heart attack, increases cortisol, heart rate, blood damage. Unforgiveness can actually increase heart rate and blood pressure, damaging the vessel walls. Those rough damaged areas are perfect to collect fatty acids and cholesterol, leading to atherosclerosis. So actually, again, the physical response to unforgiveness. This was an actual study where they did a 10-week forgiveness program, so just on forgiveness on males with coronary heart disease. And the participants in the forgiveness model actually improved on measures of forgiveness, state anger, and anger reaction from post-test, significantly reducing anger-induced myocardial perfusion defects, which is blood not delivering to the capillary beds. It literally, just by focusing on forgiveness, actually improves their cardiac results. One study. Cortisol accumulates after stress. Cortisol turns off the immune system after adrenaline has sped it up. So we talked about, again, if it's turned off, we're going to get sick. Damaged cells produce anti-inflammatory, inflammatory interleukin cytokines, which draw white blood cells to the area to eat infectious materials. Stress interrupts that process. We get prolonged infections. And actually, our white blood cells don't eat off infections because we are pissed off. So literally, it eats us from the inside. Indirect effects. People who are chronic unforgivers, we call them jackasses, are more readily engaged in arguments and conflicts, leading to chronic anger, relationship disruptions, and injuries as a result of physical violence. How many times we see patients, particularly in the antisocial personality category, who we look and say, why are you making your life so hard? You're just making every wrong choice possible. And a lot of it goes along with this. They make these decisions based on they're not going to forgive life for screwing them over. They're less likely to be productive and more likely to drive other people away, including therapists.
So is that borderline condition?
Yeah. Yep. Part of it. 9 studies with depression predicted forgiveness predicted decreased forgiveness predicted increased depression in 9 out of 9 studies. 8 of 13 looked at anxiety, and all 8 demonstrated a positive correlation with anxiety and forgiveness. 5 studies looked at mental health, and 4 of those had decreased mental health with increased unforgiveness, resentment. Other areas such as PTSD, substance abuse, phobia, panic disorders need to be considered as well when it comes to forgiveness. One of the things that I did with the spider is, in sitting there, I had to think about, how are you helpful? How can I forgive you for being ugly and creeping me out? And it's not his fault or hers. This is how she was made. And by forgiving her for being creepy, she was less scary. And that's why they're reciprocal. I don't want them on me. They're reciprocal. There's only one published experiment of forgiveness and well-being by these people in 2003. Forgiveness was associated with general well-being, but the relationship was stronger in strongly committed relationships. If you have a good, healthy relationship, it actually worked better. Cognitive dissonance mediated the relationship between forgiveness and well-being. The tendency to forgive one's spouse was more strongly related to well-being than the tendency to forgive other people. Again, the age may have been a factor. We tend to like our spouse the longer we are with them, unless we were getting closer to divorce. There's the one experiment. It may be tempting to assume that resentment and negative emotions are associated with cause physical problems, but other explanations are possible. They don't tend to cause it, they do tend to make them worse. For example, resentment could lead to violent retaliation, which results in injury. So people who are unlikely to forgive tend to die more because they get in knife fights. Maladaptive or ineffective coping styles such as drinking may also have a role to play in the physical correlates of unforgiveness. People will often drink if they can't forgive, or use drugs, or engage in sex, video games, things like that are to an unhealthy degree, which may affect the quality of their life because they're avoiding thinking about the pain. So pathways to positive effects. Positive emotions may influence physical health by boosting the immune system. That is controversial. Providing information from which to learn, activating psychological resources by activating positive feeling states. When people feel good, they're more likely to ask for help, which is kind of strange. Positive mood can motivate health-relevant behaviors. It's hard to exercise when you're depressed. Strangely enough, when you exercise, you feel less depressed. And activation of social support. It's easier to make friends when you are not a grouchy mope bag. you get to see where I was 10 years ago, a big Dream Theater fan. Wind up of pain. This is when part of the body is in pain for a long period of time. Many signals are sent to the brain from the spinal cord. As a result, the interneurons fire much more easily, carrying more messages than is normal. These are typically overweight people who have fibromyalgia, where if you touch them, they will like, ow, ow, stop it, ow. They're not being a wuss. They actually do hurt more because their brain is paying much more attention to pain over time, so that little stimulation is now perceived as pain. That's called wind-up of pain. That decrease in threshold for firing the nerves is called wind-up and explains why it's more sensitive to pain after chronic pain has been present. In short, we don't get used to pain. It actually gets worse over time if we don't address it. How does the concept of wind-up apply to emotional pain that accompanies an emotional injury? The more we think about how much they hurt us, the more they hurt us. So part of it is learning how to let go of that rumination. Something like EMDR works, but it has nothing to do with this whole tapping bullshit. EMDR works by its exposure to response therapy, with response prevention. It works because they address the feelings and the trauma in a safe place with a person that they trust. They can experience the feelings and then begin to let them go over time. So actually, you can do EMDR without tapping at all. It works great. How does the concept of wind up apply emotionally to, I'm going to do that one. So how can forgiveness help short circuit emotional wind up? It's kind of an obvious one. By forgiving, we don't ruminate on it, and we're able to let it go better. I think we're getting close. We're getting bored. Oh, God. The sensory homunculus. This is a fun one. Basically, it's an area of the sensory motor cortex, which is up here. Activations in this area correspond to sensations in the limb part of the body. So basically, that can occur even when a limb has been severed, such as in phantom limb pain. The nerves are still there, so if you sit with a stump, you'll feel the pain in your brain as if it was in your arm. So for example, this one, sensory homunculus. This is the part of the brain, so you can see that there's different parts that are bigger. So here, our lips are extremely sensitive. That's why we smooch people, because it feels good. So we dedicate a lot of our brain to processing sensation from the lips. That's why kids stick stuff in their mouth all the time as they're exploring the world. We don't feel a whole lot in our elbow. So if you grab your elbow, you're not going to feel much of a pain. Tongue, you feel a whole lot. Things in your mouth feel really big if you have a tooth problem. So here, if that part of the body is lost, if you lose your nose, you stimulate this part of your brain, you'll still feel nose pain. So this is kind of an example. It's called phantom limb pain. When people are out of our life, we still have the same experience, the emotional homunculus. So they can still cause pain even if they're not with us. Does that make sense? Just kind of a metaphor there that I was. Oh, got bigger. Oh, that whole part was. Okay, let me go back to that one real fast. With this one. So like with your finger here, for violin players, this is like the normal part of the brain that goes to the fingers. But violin players, when they play, it actually expands literally that part of their brain. So if you stimulate this part now, it's attached to the finger. So they actually get better at feeling the strings. Emotional pain is the same thing. If we think about something, we now dedicate more of our brain to that processing, and it becomes a bigger part of our life. I'm just going to skip all that one. So basically, the emotional one, when you hurt your finger, your experiential world shrinks to encompass just your finger. When you get hurt, that's all you pay attention to. Everything hurts. It's just your finger. When you have been wronged, suffered an emotional injury, our emotional world shrinks to the part of our life that hurts us. We made you great in everything. Yesterday was a great day. Good day of therapy. Got to do some things at home. Was great. Had to take the renter to court. I was frustrated. It's like, I had to take her to court. Such a bad day. It was a 1 hour part of a 24-hour day. So that emotional part shrank to just that experience. I missed out on 23 hours of pretty good stuff. So forgiveness can shrink the emotional homunculus back to normal. The word homunculus is an awesome word to say. Can emotional phantom limb pain occur even when the person is harmless and removed from our life, such as death and incarceration? Absolutely. They don't have to be with us, they still hurt us. We see that with people who've been abused. They're constantly continuing to be re-abused by their own tapes in their heads of what the abuser would say. Emotional forgiveness is more than simply deciding to forgive. That's a decisional forgiveness. It involves experiencing deep emotions and then releasing those negative emotions. Again, that's why EMDR works, because you have to experience it in the moment and release it. Involved in emotional unforgiveness. The negative emotions of bitterness, resentment, hostility, hate, and unforgiveness can eat away at our bodies. It will unbalance and destabilize our minds. It will undermine the foundations of interpersonal relationships. It will damage our spiritual lives, our sense of harmony and peace, and even our relationship with God as we understand Him, her, it, them, all of those things. Forgiveness and anxiety. People who forgive an opponent show a significant decrease in anxiety. There's a boxer who's famous for doing funny things when they touch gloves. Normally they get all angry and they touch gloves and they're going to kick your ass. But he'll do things like give the other person flowers or give them a bottle of water, or they'll like do this and laugh. And actually they've discovered he makes a lot more friends with the other boxers because he does that versus staying angry with them. And he actually feels much more relaxed in fights. This should decrease the stress response and lead to increased immune function and health when they forgive an opponent. I like this one. He that cannot forgive others breaks the bridge over which he himself was passed if he would ever reach heaven, for everyone has need to be forgiven. We often ask people to forgive us for things that we hold them accountable for. That makes us hypocrites. And so we have to be able to focus on being able to forgive other people as if we would like to be forgiven. Okay. God, how long this was. The new science of the heart. Basically says this is heart rate variability. Anybody here do heart rate variability biofeedback? I know that Neil does a lot of it. Okay. Recent research in cardiology and neurobiology suggests that emotions have a profound effect on the body as well as the brain. Blah, blah, blah. Okay. Basically, heart rhythm and pattern influences higher brain centers. So when people relax, their heart beats slowly and sends signals to your brain that I must be relaxed. I must be safe if I'm relaxed. So by teaching people to relax, they can feel safe and then begin to process emotional situations versus feeling stressed all the time. People who consistently forgive others have lower blood pressure and myocardial atrial perfusion, that's what that is, as well as pressure products. But basically, actually, if they forgive more, their heart functions better. High trait forgivers, people who forgive a lot easily, have the least reactivity and recovery patterns, so they're able to recover quickly. It's like, I forgive you. It was a mistake. Low trait forgivers in unforgiving states have the highest levels of cardiovascular reactivity. Their hearts reacted the strongest to people hurting them, and the poorest recovery patterns. So people who are type A persons who are aggressive, hostile, time-focused, and unlikely to be high forgivers, they get angry. And then what happens to type A personality people? Heart attacks. Path analysis indicated that trait forgiveness predicted state forgiveness, higher state forgiveness, and lower hostility produces lower stress levels, which then produce lower self-reported illnesses. So basically, if you're kind of following the path of it, if you're able to forgive, we do experience less illnesses, at least in this particular study. Negative emotions have a much longer lasting effect on heart rates than do positive emotions. So if people screw us over, we're angrier longer. So we have to do more sessions of therapy at $200 an hour just kidding, to make them feel better. It takes more time to feel better than it does to hurt us. We see this in restaurants. If you go to a restaurant and you get sick from their food, persuasive for psychosomatic disorders and targets autonomic